Hello, I'm Val Gleason, President and CEO of Newton Medical Center. And today we want to talk about COVID, but let me take my mask off. Something that we should be wearing when we're in close quarters with other people. As you know, our lives have been turned upside down for the last few months by the threat and spread of a terrible disease, COVID-19. Friends, family, jobs, the comfort of daily routines, and our financial security have been disrupted. We've each dealt with this in our own ways. For some, stay at home has been a welcomed opportunity to take care of unfinished projects, reconnect as a family, kickstart that fitness routine, or even try out a new hobby. But for others, it's meant isolation, bored and irritable children, a need to grieve the loss of a job or a loved one, stress about paying bills or how to get groceries, depression, inactivity, and even binging on everything from food and alcohol to television and video games. For essential workers, it's likely presented a new set of challenges. Stress coming from all directions, that fear of letting others down or becoming sick and infecting loved ones. Then there's the guilt as you collect your own paycheck, knowing others that you know and love are going without one. As a healthcare organization, we've faced our own battles. Tough decisions have been made, like temporarily reducing services. We also furloughed some staff while asking others to care for patients on the front line. And at the same time, we've prepared our own homes for the worst should we be struck ill and not survive. These are decisions nobody wants to make, but they've become part of our new normal. However, it's because of these decisions and my personal role in our healthcare organization that I want to give everyone at home my utmost sense of gratitude. You deserve an enormous thank you. The things you're doing every day are making a difference in our community. Yes, some of these things feel strange, but they're each remarkable in their own way. For example, because you've stayed at home, you've helped save the life of a healthcare worker. Because you are washing your own hands, cleaning surfaces around you, and avoiding touching your face, you're also protecting your own loved ones. Because you're wearing a mask in public, covering a cough or sneeze, and practicing social distancing, you're keeping essential workers safer. Your support and sacrifices have not gone unnoticed. Through it all, we're prevailing together. Now we face a new normal. As you recall, a couple of months ago, our goal as a community, state, and nation was to flatten the curve of COVID. Thanks to your efforts, we're seeing this happen. Now our conversations have moved from how do we stop the spread to how do we also safely return to work? The answer to these questions are not simple, nor does one size fit all. Whatever we do, we must be purposeful, cautious, and strategic as we move forward. Failure to respect the delicate balance of the situation can result in clusters of COVID-19 outbreaks and growth in our community spread. Again, our reactions to this next phase in the pandemic will vary. Some will welcome the return to work and are already ready to jump back into business as usual. Others fear the road ahead and prefer to stay at home until a vaccine is perhaps readily available. Remember, we flattened the curve by listening to the facts and working together. So we will successfully face this next task by doing just the same. Just as you are preparing, so is Newton Medical Center. Through all of the COVID-19 struggles, your health has been our focus. Our commitments to your health and safety remains unchanged. As Newton Medical Center begins the process of returning services to our hospital and clinics, rest assured that precautions have been taken to ensure the safety of all our patients. Here are just a few of the current safety practices that you will see. First, limited entry points for patients, visitors, and support people Ensure that everyone is carefully screened and masks are provided before entering patient care areas. Next, Newton Medical Center employees and medical staff follow a daily health screening procedure because protecting you starts with protecting ourselves. Virtual appointments for our primary and specialty care clinics are now available. All you need is a phone or a computer with a camera. Our staff and environmental services team are constantly cleaning, using state-of-the-art cleaning solutions and other tested techniques to prevent the spread of COVID-19. Newton Medical Center frontline staff at the hospital and clinics are trained on precautions to take when treating patients with COVID, whether suspected or confirmed, to limit exposure and spread. Specialized rooms for containing contagious diseases are available at all locations so that we may continue to safely serve all who are in our care. Some of these practices may create delays in how you used to receive care at Newton Medical Center. So we thank you in advance for your patience as we take the extra time and precautions to keep everyone safe. As our community and our nation continue to strike the careful balance between stay at home and getting back to business, I'm reminded of a blog I wrote just before the news of this pandemic came out. The blog was about the effects of long-term stress on our health. Yes, some of us may appear more resilient than others during this difficult time. However, no matter how resilient we are, prolonged stress can do strange things to our bodies. We need to take care of ourselves and each other. The CDC has provided us with some good resources about stress on their website, which is found at cdc.gov. They talk about how stress during an infectious disease outbreak can include things like fear and worry about your own health and the health of your loved ones, changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health and mental health conditions, and increased use of alcohol, tobacco, or other drugs. They also share signs to watch for in your children and ways to cope, like taking breaks from watching, reading, or listening to news stories, including social media. Hearing about the pandemic repeatedly can be very upsetting, especially to small children. Take care of your body. Take deep breaths, stretch or meditate. Try to eat healthy meals, exercise regularly, get plenty of sleep, and avoid drugs and alcohol. Make time to unwind. Try to do some other activities that you enjoy. Connect with others. Talk with people you trust about your concerns and how you're feeling. Stress can wreak havoc on many of our internal systems. So if you or your loved one is demonstrating signs of stress and you feel unable to manage it, contact someone, a doctor, a counselor, pastor, or friend. Just because we're staying at home doesn't mean we can't seek help from outside of our four walls. As always, we are here and ready to serve you at Newton Medical Center. Please stay attuned as we begin returning some of your needed services. If you had appointments or non-emergency procedures that were canceled under the CDC's guidance of flattening the curve, our staff members will begin reaching out to you over the next few weeks to begin rescheduling. If you've been waiting to seek care for non-emergency needs, many of these services will be available to you in the coming weeks. Please call and set up an in-office or a virtual appointment. More importantly, if you have an emergency condition, such as chest or jaw pain that may radiate to the arms, or choking, breathing difficulty, head injury, an electric shock, a severe burn or prolonged seizure, a high fever with a stiff neck or headache, poisoning, or noticing the signs of a stroke, which is often displayed as sudden weakness or unable to speak, drooping, dizziness or weakness, heavy bleeding, or severe bone fractures, we want you to call 911 and come to the emergency room. You need to be treated. The health system, including Newton Medical Center, is beginning to see patients who have tolerated conditions at home for a day or more in fear of coming here because of COVID and are now very ill. If in doubt, we want you to call 911 and we'll evaluate you even if it turns out to be not serious after all. We'd like it to be better safe than sorry. The EMS ambulances and the hospital emergency room are safe because we each prepared to separate you from someone who has COVID. The EMS ambulances are thoroughly sanitized after each transport. We look forward to continuing to care for your health needs, but most of all, take care of yourself. Stay safe, stay healthy, and thank you again for all you're doing to help combat this new illness.